attacks can be triggered by a variety of different things. Panic attacks actually have a really functional basis, as it were. The fight or flight response, which is in our DNA through evolution, developed because when we were confronted with a threat, we needed to have our heart beating fast, all our blood rushed to our limbs, be really, really focused, because we either had to deal with that threat or run away from it. Now, all those years ago, the threats tended to be like really big, hairy animals. These days, that kind of throwback to all those years of evolution means that threats like exam stress, first dates, job interviews, we have the same response to them as we did to those big dangerous animals. So instead of it being kind of a functional stress that helps you focus and study, you begin to feel queasy, you may become short of breath, get heart palpitations, and the thing is, the more you attend to those things, the more you focus on those physical emotions, the worse they tend to get. So it sets up a vicious cycle, and this is what's known as a panic attack. Physical symptoms of a panic attack tend to be heart palpitations, shortness of breath, queasiness, and dizziness. The cognitive side of it, the thoughts that you get with a panic attack, tend to be very high levels of anxiety, worry, and focusing and ruminating on one specific thing. When you're having a panic attack, the best thing that you can do is focus on a two-pronged approach. Number one, coping with your physical symptoms, and number two, coping with your thoughts. So for a lot of people, it's about regulating their breathing. And I often tell people to try and just hold their diaphragm and take deep breaths. So few of us rather breathe correctly. If you're able to kind of regulate the breathing, it starts to help calm you down. The other thing that's really important to do is start telling yourself that the threat that you perceive probably isn't real at all. Now, there's two ways that you can do this. You can either challenge those thoughts or you can distract yourself. And there's great ways of doing this. Patients of mine that were worried about being on trains will do things like, say the alphabet backwards, or count how many people are wearing red, or do something that distracts them. If you feel distraction isn't working for you, then telling yourself, well, what are the odds that something bad's going to happen on this bus? How many times did this happen before? How can I cope if it does? So working on those thoughts to being able to challenge them. The best way to learn how to do this usually is with a therapist. They're going to be really good at helping you kind of connect with the right thoughts, because you're not just a person with a panic attack. You're you, and you happen to have panic attacks, which means that you're going to respond differently than a lot of other people. So it's really getting down to what works for you and figuring that out. Panic attacks respond very, very well to cognitive behavior therapy. If you can figure out what's triggering them, what are those things that cause them, and you can then work on changing the way you think about them, you can work on the panic attacks. There's great tools that you can use. Imagery, relaxation, proper breathing, thought monitoring and challenging. All these are great tool bases to be able to kind of confront the attack and move forward from it.